Today there are 76 new confirmed cases of COVID-19 and 13 new probable cases. There are no additional deaths to report in New Zealand. There are now 92 reported cases that we can confirm have recovered from COVID-19. So the combined total of confirmed and probable cases in New Zealand is now 797. That's an increase of 89 since yesterday. Today, there are 13 people in hospital with COVID-19, including 2 in ICU. All patients are stable. There are more details on our website about just which hospitals those people are in. For those cases that we have information on, we are still seeing a strong link to overseas travel, that is 51% of cases, as well as links to confirmed cases within New Zealand, 31%. And at the moment, we're only categorising 1% as community transmission. But I do want to point out that a further 17% of cases are still being investigated, and we fully expect that many of those will transpire to be community transmission. Community transmission is essentially a categorisation by exclusion, so we have to exclude any tie to international travel or to an existing probable or confirmed case. So once again, 17% of cases are still being investigated, and many of those we expect will transpire to be community transmission. There is updated information on our website around the current clusters in New Zealand. What I can say is just at a high level, there are now 6 clusters of 10 or more people. There were 7 yesterday, but one of those is now less than 10, so we have taken that off. And further information, updated information about the number of cases in each cluster is on our website. In terms of laboratory testing, our test capacity continues to grow significantly. Yesterday, our labs across the country processed 2,563 tests, bringing our total number of tests completed to date in New Zealand to just over 26,000. We now have the 8 labs around the country processing tests, and by next week that will be 10. Our total volume that we can process each day is now over 4,000 tests, and in the last 7 days, the average has been 1,835 per day. We know that in terms of both capacity and increasingly in terms of testing, we benchmark well with other countries, particularly in terms of where we are at in the stage of the outbreak in New Zealand. And I just want to acknowledge the huge amount of work that has gone on amongst our labs over the last few weeks to increase our capacity amongst the staff there and the work they've been doing. And we have had for several weeks a national network of labs that convenes every day by teleconference. And we because we have that number of labs with a number of different platforms on which they do the testing, we're not reliant on a single platform, so we have, in a sense, our eggs in more than one basket. And likewise, it means that we can use that testing capacity around the country where and when it is needed, so we can move test volumes to another lab if needs be. So we're starting to analyse the information about where COVID-19 is in New Zealand, and we know that we've had the most number of cases in the following 4 district health boards: Southern DHB, and that's particularly around the Queenstown area, Waikato, Auckland and Waitemata. And one of the things we're now wanting to do is to look at the details of where those lab tests have been undertaken so that we can build a picture of the rate of testing in each region. And that will help inform our decision making about moving between alert levels. Just moving on to personal protective equipment. There's been a lot of interest in that, and in particular I think the distribution of masks out to all our frontline workers, whether inside hospitals or out in our community providers. As I've said in the past, we have plenty of that equipment available across New Zealand, and more is on the way, and we have that very clear clinical advice about the situations where practitioners should be using PPE. So over the last 7 days, we've distributed 1.8 million masks around to DHBs and more widely in the sector. I can also confirm that on Tuesday night, we confirmed an order of 41 million additional face masks that will start to arrive from next Monday and continue to be delivered over the next 6 weeks. And the DHBs are leading the distribution of face masks and other PPE to the range of providers in their region. So just another couple of other stats about PPE that's on order. At the moment, we've got 23 million pairs of gloves in the country. We've got over 1 million more on order, so the stock keeps coming. We've got 850,000 glasses, safety glasses or equivalent, and 640,000 face shields on order as well. So in addition to our good stock on hand, we are making sure that those supply lines are good so that we continue to have an uninterrupted supply. Just another word on health sector preparedness. Our hospital-based staff have been working hard over the last couple of weeks to free up capacity, and we know that our hospital occupation rates are around 50% across the country. It does vary somewhat, but that's much lower than they usually are. And our ICUs in particular have been doing a huge amount of work to get prepared over this last week to be able to look after people who might need ventilation or intensive care, not just in their current settings, but in other parts of the hospital. And I think you heard a bit about this yesterday, but I just wanted to pass on a text that I had from one of our District Health Board's CEOs a day or two ago. He said, just spent an hour up in our ICU, incredible clinical leadership and planning from our senior medical officers and nurses, so humbling. And so our ICU staff are all geared up. They've got their plans in place to be able to deal with and treat additional people if that is required. As I said earlier on, at the moment, we have just 2 people in intensive care around the country. And finally, just an update on flu vaccination. We know that we've got nearly 900,000 vaccines that have been sent to providers this year, and that is the first, I guess, instalment of a total number of vaccines that will be 400,000 more than last year. So we have brought forward the vaccination of people most at risk, and that is happening apace around the country, as well as vaccinating our frontline health workforce. There is still plenty of vaccine out in the sector, but I'm aware that there is a distribution in some areas where redistribution needs to happen, and that is happening. For example, I know that the New Zealand Defence Force released 500 doses in Whangarei to go to local Māori health providers to immunise people who are over 65 or have existing health conditions. And the Occupational Health Service in Wellington released a similar number to the DHB in Wellington to help vaccinate our frontline staff. So we have plenty of vaccine. Another 100,000 doses are just going through the QA process. They arrived in the last day or two, and we have another 200,000 doses arriving on shore over the weekend, and they'll be available for distribution next week. And we've got this sector-wide effort to redistribute locally so that practices and others can vaccinate those high-risk people and people over 65. I'll leave it there, and I'll hand over to Mike Bush.
Kia ora, Ash. Kia ora koutou. Several things I'd like to cover off today. First is to again acknowledge the wonderful New Zealanders that are strictly complying with the conditions that are in front of us. They all know that to stay home will save lives. But I'm also aware of some isolated incidents where people are not necessarily complying, and I refer, for example, to the commentary out of Kaitaia this morning by Dr. Lance O'Sullivan, suggesting that more needs to be done. I can say that we have deployed more of our police staff up into that area to again engage, educate and encourage people to do the right thing, as the majority are doing. And of course, if that doesn't work, there will be an enforcement follow-up. I'm also aware of the issues around getting real clarity about what you can do and what you can't do. And I'd like to ensure that people do go to that COVID website. We're building it every day. So the scenario that might be in front of you, the queries and concerns you might have should be addressed through that website. Next thing I'd like to talk about is in terms of what's happening inside police demand. We've had a significant drop-off, as you would expect, in quite a few areas. We haven't had the significant increase in family violence, family harm through reports, but I am aware from those who are working on the ground in this, particularly NGOs, particularly in areas like counties Manukau and others, that there has been an increase in family harm, family violence. I will repeat that it's an absolute priority for us to attend and respond to these incidents. So if that's occurring in your place, please call us. If you're responsible for that kind of thing, stop and respect others. Be kind, be compassionate. Happy to talk about any more of that also. In terms of our own staff, I've been asked a number of times, do we have the personal protection equipment required? Pleased to say that we've issued recently 9,000 individual kits to our frontline staff, and they contain goggles, they contain gloves, they contain masks, cleaning agents, so that our staff have what they need. That doesn't mean we're stopping there. We're continuing to build stocks for our people. And if they are going into homes where there is an existing bubble where they're invited in, they will wear that equipment. I want to finish by saying, some of you may know this is my last day as Commissioner of the New Zealand Police. I'm extremely proud of the people, the 14,000 people inside the New Zealand Police, but also our emergency services partners and everyone in hospitals, private and public, that are on the front line of this response to COVID-19. What they do, the professional way they do it, the courageous way they do it, to keep everyone safe. So can I, from the bottom of my heart, thank all of them for their commitment to their country and to the people of New Zealand. For clarity, I am staying on in my role as part of the all-of-government response to COVID-19 in a role of strategic leadership of the operational response.